Oh, okay. Good morning. I'm Shara. I did my PowerPoint on sepsis. Will you go to the next slide for me, please?
Yes, ma'am. Okay. Is that the next slide, or did I go too far?
Go back one,
Okay.
please.
That right there? Is that the correct one?
Oh, there we go. Bingo. We got it.
Excellent.
Okay. So what is sepsis? Sepsis is basically, sepsis happens when the body can't fight off infection and it basically gets in the blood. So, it can be life-threatening. Wait a minute. So really the body releases these chemicals that are supposed to help fight off infection. I guess that adds on to our white blood cells because they fight off infection. And when that does not happen, it triggers some kind of change that can cause like traumatic damage to our organs, and our blood pressure drops. So when you become septic, you go into septic shock, which is really when the organs start failing, and that is when that sometimes leads to death. Just depends on the situation of the person. Various consistent infections include pneumonia, the flu, urinary tract infections, and pressure sores. I got a question down there. It says, what kind of patients are more susceptible to becoming septic? Patients that have trachs, because if you have a trach, you are more prone to getting pneumonia. Patients with catheters. If you have a catheter, you get a lot of UTIs. And patients with HIV, just because the immune system is weak and it's already weak and it's not fighting. Okay, next slide, please.
Okay, give it just a moment. There's a little bit of a delay.
No problem.
There we go.
Okay, so what does sepsis affect? Everything. If there's a need for blood flow, there's a chance for it to be infected. The heart is usually the first organ to be affected. Why? Because if we get infection in our bloodstream, and our heart is trying to pump blood, I mean, clearly it's just not going to work. Sepsis can spread to the bloodstream without proper care, which is basically antibiotics, or if you're just keeping a good eye on that. Like I said earlier, individuals who have a compromised immune system are the ones that are at risk for becoming septic. Okay, next, please. Treatment. Treatment includes different antibiotics. I've been through this previously with my aunt, and she had 3 different antibiotics. I can't really remember the name of them just because I can't pronounce them. But she had, 3 different antibiotics given through IV. She had some kind of blood pressure medicine that'll kind of stabilize the blood pressure, because once you become septic, your blood pressure will drop. It can happen quite a few times before you even know what's going on, so that's the scary part. And then we have a vasoconstrictor, which narrows the blood vessels. Okay, next. What can we do as an us? Monitor, because we are usually the first people that notice something about our patients. We are always with them. We notice everything, every small thing. You know your patient, observe and report. This is kind of big for me, just because I don't want to get too much into that. That's on the next slide. But just make sure you pay attention to everything, because sometimes symptoms can be the same for different conditions. So we tend to just go with the first thing that we think of, when it can be something else that's totally, that's more severe, I guess I should say. And document everything, especially if it's consistent. Time, what the person was doing, what happened, all of this stuff matters. Next, please. Okay, so what are we reporting? I have some notes that I put up just from what I was remembering with my aunt. I'm just going to give y'all a small background of what happened and just narrow it down. I had two aunts that were in a car wreck, and they were hit head on by a drunk driver. One of my aunts passed just off of the compact, and my other aunt was paralyzed, and she was a quadriplegia, which means partial or total loss of all four limbs or the torso. And she couldn't move or anything, and she ended up having to have a trach. So first, I'm gonna talk about what are we reporting? Sudden dropping of blood pressure. My aunt's blood pressure dropped in her sleep. I don't know how many times. She lived a year, but when it got to like September and October is when we started kind of noticing some things that was just kind of different from her condition. So the blood pressure was just, we didn't know what was going on. Coughing up sputum. She constantly needed to be suctioned just because she already had a trach, but that goes back to observing and reporting. The color of it was like almost the color of this sticky note and this sticky note. It's green. I don't know if you can see that. So we just thought maybe, she has pneumonia again. She had pneumonia maybe twice a month. Another thing that we are reporting, a decrease in urine. If you have a catheter and they're not producing a lot of urine, that's one thing you look for with UTIs. She constantly got a UTI. We thought it was just because of the catheter. Honestly, we didn't really pay attention to it just because we already knew to expect that. So that was another thing. Confusion. It's a funny story. Me and my cousin, we took turns watching her. She wanted some candy, and we had literally just put a piece in her mouth. Literally, like she chewed it up and she swallowed it. She was eating good, but she still had that trach in. So not even 5 minutes go by, and she's asking, "Where's my candy? Where's my candy?" And we're like, "Hey, you just you just ate it." And she's going off, "I know I didn't eat my candy. I just put it in my mouth." Mind you, she could not move or anything, but she was not about to tell us that she did not put that piece of candy in her mouth. Like, girl, ain't no candy there. So I lifted her arm and I showed it to her, and I was like, there's no candy in your hand. And I mean, she rolled her eyes at me like I was the one to know what I was talking about. So confusion also comes with UTIs. So of course, we didn't really pay any attention to that. Just like, okay, it comes with the UTI. Next, we're reporting chills. Her temp was always sky high, but her body was cold. If that makes sense. I don't know if anybody's like experienced that with being sick, but I mean, her temp would reach to like 103.4, maybe a little bit higher. And I mean, that's a big risk for somebody whose body can already fight off things. So she used to also tell us she was cold. And that really tripped me out because I'm like, girl, you can't feel anything. How are you telling me you cold? But if that's that phantom stuff. If she says she cold, give her a blanket. The last thing was staring into space. This is when she went into septic shock. She was kind of in a trance and she was just staring. Her eyes were very book and dilated. She stopped talking, but she was kind of moving her mouth as if she was talking to somebody, and we just thought she was just we also thought it was just the confusion. But when we ended up taking her to the hospital, we knew that she had already turned septic and she was purely into septic shock. That was kind of scary. We just called it at that point that she was transitioning. from this world, because the before the day that she just completely shut down, she was one night she opened her eyes and she went, wow. And we were like, what you see? And she didn't answer us anymore. So that's we was like, okay, well, she's made her transition. So those are the things that you need to look for. Once again, UTIs can go with confusion, coughing up stuff can go with pneumonia. And, I think we just don't pay attention to those things because they're common. But, I mean, all those things coming together can cause a person to be septic, especially if they're not moving. And her like on becoming septic, it came from a stage 4 pressure sore that was this big, like right on the top. And I mean, she always laid on her back. So it really was too late for that. Okay, next, please. These are just some photos. This is kind of what her stage 4 pressure sore looked like right here at the top. It really looked just like that. We had to clean it every day. And that's really all you can do is just try to keep it as clean as you can. Some gross, interesting stuff though. I found this picture here, newborn sepsis. I had never heard of that, so I just put a little cut right here that I'll read. It's most often caused by bacteria. A baby may become infected before birth if the amniotic fluid is infected. During delivery, the newborn may be exposed to an infection in the birth canal. Once born, a baby may be exposed to infections in the hospital or at home. Babies are more vulnerable to get anything as soon as their head pop out. So that's just a fun fact. That's a picture of my aunt right there. I think that was her second to last day. I want to say she passed the next day. I don't know if you can see it or not, but she's still kind of in that trance, just staring. She kind of could understand us, and I could say, okay, if you see me blink, and she would try to blink, but that sepsis had kind of took over quick. And I mean, once it hits. So just be careful with that. And that is my project. Thank you.
Very good, Shara. Very, very good. Very thorough, very informative. You told everyone what body systems it affects and the treatment we give. And I think the most important thing for everybody to realize about sepsis is it can happen very quickly, and it's very hard to reverse. Once you go into septic shock, it is very hard to reverse. And like Shara said, especially if you have patients who are what we call immunocompromised. So they already have things that are going on in their body, like you said with your aunt. So very, very good, Shara. I'm so proud of you. Does anybody have any questions about Shara's project?
Yes, any questions, people?
Then you should be able to unmute yourselves.
I'd like to make a statement. Can you hear me all?
Yes.
Yes.
That was an excellent presentation of sepsis. That's one of the best I've heard. And I want to commend you for how you presented that. I think all these students will remember your family member, and they'll be able to equate what can occur then from not only a quadriplegic, but also sepsis, the skin breakdown issue to the neuro issues. That's superb. You mentioned about the blood pressure. That's what's critical with sepsis. And that was very good. Have you applied to the PN program?
I took my test, but I missed it by 5 points. I might, ma'am.
Let's talk. That was really good. I'm really proud of you.
Dr. Mullins is trying to recruit my students, Dr. Jones.
I see that. That's wonderful. That was a great presentation. Shara, I lost my sister-in-law about 2 years ago, and she died of sepsis, septic shock. She had an abscessed tooth. She was 45 years old, and she died from an abscessed tooth. But it took her 3 weeks in ICU to pass away. It was horrible. So, great presentation.
Thank you.
Very good, Shara. Okay, so next, Sam, get in. Everybody's so needy these days.
That's right.
Hey, this is Amanda. Can I say something to Shara?
Sure.
Shara, you did a great job. Just wanted
Thank
you to
you,
know
Miss
that I love
Amanda.
you.
I didn't know you was on here.
She took care of my babies at North Oxford Baptist Church. I'm so proud of you.
Thank you. Good to hear your voice.
Thank you. I just wanted to let you know I watched. You did so good.
Thank you, Miss Amanda.
You're welcome.
Okay, so next we're going to go to Kesey. Is Kesey here? No?
I don't see a Kesey in the room here. Would Kesey be on somebody else's phone or under another name by any chance?
No.
I'm gonna text her.
Okay,
Okay.
please do.
Great.
Please do. Okay, Ayana, we can pop back over to you.
Is my screen working?
Yes.
Yes.
Okay. My poster is on chronic kidney disease. I chose this because my grandma has it and she's 90-year-old. The definition of chronic kidney disease is a long-standing disease of kidneys leading to renal failure. The kidneys filter waste and excess fluid from the blood as kidneys fail, waste build up. Next one is what body system doesn't affect. It affects your cardiovascular system. Your cardiovascular system, which makes the kidneys result in a heart attack or stroke. Kidney disease may inflict widespread damage to the cardiovascular system, resulting in a heart attack or stroke. Like I said before, the cardiovascular system is compressed of your heart and your circulatory system, but it also impacts the lungs and even the body tissue. What is the treatment? You can either have kidney transplant or treatment for NSAID, which is dialysis. I know they had my grandma on blood pressure medicine and a couple more medicine to kind of help with that, but it kept putting more fluid around her kidneys. The treatment depends on the severity. Medication help manage symptoms, and in later stages, they use dialysis. And if it's worse than that, then they may can do a transplant. Monitoring chronic kidney disease. Glomerular filtration rates monitor the progression of disease, changes in functions, or well-being over time. The second one is monitoring your blood pressure. That's both a cause and complication. In there, that direct evidence, no randomized controlled trials have elevated the clinical outcomes for patients with stage 1 and 3 chronic kidney disease who were systematically monitored for worsening kidney function versus no CKD, usual care or in an altered CKD monitoring regimen. The next one, well, it's still on monitoring. The third one is monitoring the protein, the creatine urine, and no protein urine, I think, and serum creatine. The fourth one was monitoring pharmacologic medicines. My grandma said that she had used those. She wouldn't tell me what medicine that was strictly for that. What should we report? Report any observations of confusion, change in mental status, change in input and output. Report also if blood is in urine or difficulty urinating. Observe for signs and symptoms of distress. Also, any changes in the patient's medical condition. This may include sudden incontinence, mood changes, injuries, or respiratory distress. Observation is important when administering care for a patient. Also, observe for any safety issues, such as dizziness when ambulating or pain in the abdomen or lower back. I know my grandma had had this for a year, but she could have kind of reversed it, but she's stubborn. She don't want to be on dialysis. So maybe about a month or two ago, she was going to get her regular doctor that she just kind of like passed out because her blood pressure was way too high. And basically they just told her you have a lot of fluid on your heart, and as they was trying to drain it, it was building more and more up. So she had to end up getting on dialysis. Right now she's on every 4 hours, Monday, Wednesday, and Friday. But they have to slap her because she keep passing out in the machine because her body just can't fight with those with the process of dialysis. So they're currently she's 2.5 hours on those days. But when I talked to her about it, she said it makes her real tired, and she really just don't like doing the dialysis. And if she could stop it, she would. But she said she's gonna put up with it. And I don't think you can probably see it, but these are pictures of a normal kidney and a diseased kidney. And one of my pictures say, "What is chronic kidney disease?" The gradual loss of kidney function. Symptoms include difficulty urinating, dizziness, and swelling. It is common caused by diabetes, high blood pressure, and I cannot say that word. I think it's glomerulitis or something like that. And the other said treatment focus on underlying cause of kidney impairment of complication. And this picture is, I can't really like read it because it's kind of blurry. I tried to make it too small. And that's it.
Very, very good, Ayana. I like how you I like how you mentioned that we need to look for incontinence in a patient because I've said this time and time again, incontinence is not a normal sign of aging, okay? So we know that if a patient all the time becomes incontinent, we need to make sure that we get that checked on. I like how y'all are, giving examples of your family during these situations because it makes it more memorable. So just like Shara and Ayana did, now when you think about your grandmother or your aunt or your dad or anybody and you see some of these signs and symptoms that Ayana just talked about, you'll kind of relate it back to their family members, and it may be more easily recognized that way. So very, very good. Does anybody have any questions for Ayana? Very good, Ayana. Okay, so we'll go to the next. We'll go ahead to the next student, and now Jackie.
I did my PowerPoint on schizophrenia.
Give me just a moment to pull that up for you.
Okay.
Now you're talking up my alley. I love mental health.
You mean like people who blame their husbands for the weather, that kind of mental?
Probably because I'm just one step shy of being by myself.
It Weeks, he got you.
I knew it.
All right, and here we go. Well, let's see. Let's go here. That's a better picture. Okay, ready? All right, can everyone see this first slide?
Yes, sir.
Excellent. All right, Ms. Jackie, it is all yours. Did we lose her?
I put myself on mute by accident.
Oh, okay, yeah. I was looking for the button to unmute you. So go ahead, young lady.
All right. My name is Jacqueline Torres, and my project is about schizophrenia. I was inspired to do this project because recently one of my family members has been diagnosed, and I wanted to educate myself a little bit more, and my family as well, because they don't really know much about mental disorders. Okay, so schizophrenia is a type of psychotic disorder that causes problems with thinking, communication, and the ability to manage emotions, make decisions, and understand reality. It's a common disease. About 1.2% of Americans have it, which is around like 3.2 million. It is more common and severe in men than in women, and the cause of schizophrenia is unknown, but researchers have suggested that a combination of physical, genetic, psychological, and environmental factors can make a person more likely to develop this condition, or even a stressful or emotional life event might trigger a psychotic episode. Next slide, please. What body system does it affect? It affects the mind and the brain. It affects the person's ability to think, feel, and behave clearly. For example, some people have trouble distinguishing reality from fantasy. Next slide, please. And some common signs and symptoms are delusions, hallucinations, disorganized speech, catatonic behavior, and even lack of emotional response. Next slide. And like there's different types of symptoms. There's positive, negative, and cognitive. And the positive symptoms are the hallucinations and the delusions and the disorganized thoughts. And negative symptoms are like reduced speech, lack of emotional and facial expressions, social withdrawal. Cognitive is like poor memory and attention and planning and decision making. And usually when patients have cognitive symptoms, it's very hard for them to make a living. Next, please. What ages do symptoms appear? Well, men tend to experience them earlier than women. They usually get theirs like around 20 to like their late teens, their early 20s, and the average ages for women are their late 20s to early 30s. And since men experience symptoms at an earlier age, they appear to have more negative symptoms than women do. And it's rare for children to get schizophrenia. It's estimated that 1 out of 10,000 children get diagnosed with it. And I also looked up about the elderly. About 25% of the elderly have late onset schizophrenia, but 75% of them are usually the ones who've been diagnosed with it since they're like early adults. Next slide, please. What is the treatment? There's currently no cure for schizophrenia, but it can be treated and managed in several ways, such as medications and psychotherapy. It can help the person improve their communication, motivation, and even self-care. And in order to be diagnosed with schizophrenia, it has to be by a psychiatrist, and symptoms must be present for about 6 months. And delusions, hallucinations, disorganized speech, or catatonic behavior must be one of the symptoms and must be active for at least a month. And those with severe symptoms, like suicidal thoughts or an inability to care for oneself, may require hospitalization. Next, please. And what can we do to monitor? Well, we can help remind them to take their medications, make sure they go to their sessions, help them maintain a healthy weight, their social skills, and be less stressed, and know that you may have to intervene if necessary. Next, please. And what should we do to report? What should we report? I'm sorry. Changes in condition or abilities, positive, negative mood changes, failure to take medicine or improper use of medicine, comments, even jokes about hurting oneself or others, behavior changes, including changes in personality, extreme behavior, or behavior that is not appropriate to the situation. My aunt, and like I said in the beginning, when she was diagnosed, it was kind of like a shock to her and to a lot of my family members, because they never really put a thought into mental disorders. They didn't really, I guess you could say, believe in that. So whenever she was diagnosed, she refused to take her medicine for a long time, and she had to be hospitalized for a little while. And she was taking her medicine for a long time, and she was fine for a while. But then, since she felt like she was fine, she didn't need it, she stopped taking it, and that's when her hallucinations and delusions got more severe, and she started hearing people. And yeah, that's it.
Very good, Jackie. Very, very good. I want to remind all of you, we've talked about this when we went through our chapter that dealt with mental health. And I think a reason that mental health is so dear to my heart is it does not discriminate. And it's still so controversial here in the United States to talk about mental disorders, and it shouldn't be. And we've talked about the biggest thing that happens with these patients is just like you said, Jackie, with your aunt. They get to feeling better, so they think they don't need their medication anymore. Mm-hmm. And a lot of times in men, we've talked about this as well, it causes a lot of sexual side effects. Therefore, they don't want to take their medication. They want to feel normal. So in taking care of a patient with a mental disorder, you want to make sure that you're educating them on taking their medication on a daily basis, the regimen that they need to do it, and make sure that they understand why it's important. So Jackie gave great definitions of how schizophrenia happens, and we don't know a reason why. And I just want to encourage everyone to, I feel like since you've been in my course, you look at mental disorders a little differently now. And please make sure that you are sympathetic to that population and don't judge, because like I said, mental illness does not discriminate. So any questions about schizophrenia for Jackie? Very, very good, Jackie. Your PowerPoint was amazing.
Thank you.
No questions?
I totally agree with Miss Weeks' comments, and Jackie did a great job. That I can't reiterate as well about all mental illness. Most all at one time or another feel they are getting better and they don't need their medicine. And that's typically when the issues occur. It's also important to always remember the family members of someone that has mental illness. Mm-hmm. Often they've been the brunt of any type of outlash, or they have been the one forgiving over and over and over. And mental illness is not something that you can just pick up your bootstraps and get over. And that's a lot of the common thing I feel that's present in a lot of religious institutions as well as Southern.
Absolutely. Also, we've talked about, we are such a society of, if you can't see it, then it must not be happening. You can see a broken bone, so we know you're in pain, but you can't see mental illnesses. So a lot of times it gets swept under the rug when we should really focus on that, just as much, if not more. Think about our prison systems. If we focused on mental illness and wellness, then we would probably transform the lives of some of those inmates, but we don't do that. So just remember, just because you cannot see a mental illness does not mean it's not there. And to reiterate what Dr. Mullins said, here in the South, it is very much a stigma. Very much. So if you work with this population, just try to do everything in your power to make them understand the illness, and take their medication regularly. Any questions on schizophrenia? Very good, Jackie. Thank you for sharing that about your family member.
Yeah, great job.
Okay, Jessica, Miss Lee.
Ma'am.
It's your turn.
Do I have a
Okay.
visual aid from Miss Lee? Yes, Jessica Lee, right there. Pulling it up now, Miss
You just
Jessica.
did all of it?
Let's see. I have, what is your, hold on a second, let me scroll through. Pancreatic cancer, is that you?
Yes, sir.
Very good. You ready for me to start sharing?
Is it 17 slides?
Ma'am?
Is it 17 slides?
Let me see. Yes.
Okay, yes, sir.
So if we aren't educated by the end of this, it's nobody's fault but our own, right?
Okay.
Okay, hi everyone. I'm Jessica, and I'll be talking about the purple ribbon, which is, next slide, please, the pancreatic cancer. I chose this because my grandmother had this, and she left us quick. Next slide, please. The Mr. Dunn, next slide. Okay. The pancreatic disease, cancer is a disease in which the malignant cells form in the tissue of the pancreas, which is the pancreas located behind the stomach in the front of the spine. The pancreas produces digestive juices, hormones that regulate blood sugar. The majority of the pancreatic cancer starts in the exocrine cells. Next slide. Well, the body system that the pancreatic Mr. Dunn, is my computer froze?
I'm sorry.
The body
Ask
system
again.
it affects is the digestive system, which is resulting. What did you say? Am I still on here?
Yeah.
Yes, ma'am. It's just the internet. It seems like you're hesitating a little bit. It's just your internet connection.
It affects the digestive system, resulting in problems breaking down food and absorbing nutrients. It could also cause bloating, gas with watery, greasy, or foul-smelling diarrhea, leading to weight loss and vitamin deficiencies. It also do nausea, vomiting, and the obstruction of the bile duct, often causing jaundice, which is the yellow discoloration of the skin, and the white of the eyes. Next slide, please. The signs and symptoms of the pancreatic cancer, of course, is jaundice. You have belly pain or back pain, weight loss, and poor appetite, gallbladder of the liver enlargement, blood clots, and diabetes. I guess my internet's slow.
It is. So what I did, I just turned off your video. So hopefully the bandwidth, it'll pick up a little bit, but that's it. It's just your internet. So you just keep going.
Okay. You can do 3 types of treatment when you have pancreatic cancer, which is you can do surgery, which is to remove the tumor, which is called the pancreatectomy, or you can have surgery to treat the symptoms. You also can do chemotherapy, which is drugs used to treat the cancer, where the patient goes into the center. You have radiation therapy, which they uses X-rays, other kinds of radiation, just to kill off the cancer cells. What we monitor or detect, we always monitor the stomach and back pain. It is very difficult to detect any pancreatic cancer because the signs and symptoms are like any other illness. And they use MRIs, CT, PET scans, ultrasounds to detect these things, which the price ranges varies. Ultrasound is average cost $243 with a MRI to a PET scan. The lowest ranges from $300 all the way up to $9,200. What do we report? We report abdomen pain. People can have a dull ache in the upper abdomen radiating to the back. Some people that have pancreatic cancer have a sense of early fullness with meals. They call satiety or an uncomfortable swelling in the abdomen, or they become very nauseous. Who's at risk for pancreatic cancer? The research has shown that obese and even overweighted men and women have a higher risk of being diagnosed with and dying from pancreatic cancer. Or chronic heavy alcohol usage can also increase the risk of pancreatic cancer, most likely by causing recurrent pancreatitis. I guess it's like inflammation of the pancreas. I guess they want to know, could you live without a pancreas? Well, it's possible to live without a pancreas, but when the entire pancreas is removed, people are left without the cells that make insulin and other hormones that help maintain safe blood sugar levels. Those people will develop diabetes, which can be hard to manage because they are totally dependent on insulin shots. And I have 4 photos of how the pancreatic stages comes. You go to 4 stages, with stage 1 being divided into 2 stages, with stage 1A tumor is no larger than 2 centimeters, and stage 1B tumor is larger than 2 centimeters. And then we have stage 2 divided again in A and B, which in A, the tumor is no larger than 4 centimeters, with B, tumor is larger than 4 centimeters. We have stage 3. It doesn't divide because the pancreas now cancer spreads to the major blood vessels near the pancreas and may also spread to nearby lymph nodes. And then we have stage 4, which when we knew anything about my grandmother, she was already stage 4, which the cancer may be in its eyes and was spread to distant organs, such as the lung, liver, and the peritoneal cavity, which is the space in the abdomen that contains the intestine, stomach, and liver. And I have one more photo, but I'm gonna have to put it up to the screen. Right, can y'all see this? Is my thing back on?
You should be able to start your video now. There we go.
You went
Awesome.
from this to this quick.
Wow.
So
Wow.
anybody have any questions?
Jessica, if you don't mind me asking, how quickly did that happen?
It was like, I was in South Dakota or whatever, but when I came back, I want to say the beginning of October, like 25 days, she was out of it. She went to being, she couldn't remember who we were. And then when she went to the final stage, it's like her eyes shut. She would never open them until it was over with. Then she opened her eyes.
Wow.
Wow.
That was very
informative.
informative. Thank you. I was not well versed on pancreatic cancer, so thank you very much. That was very good. Does anybody have any questions for Jessica?
What were your grandmother's first symptoms? Do you know when she first started feeling bad? What did she complain of? Do you know?
No, ma'am, because she was very secretive. Like I said, when we found out anything, my grandmother had to move in with us.
Okay.
But she was losing weight real fast.
Mm.
Very good, Jessica. Very,
Yeah.
very informative. Thank you very much. Okay. Next will be Miss Elizabeth.
Is that Elizabeth Accardi?
Mm-hmm.
Yeah.
There we are. Excellent. You look so thrilled. Did you send a PowerPoint or anything that I need to queue up?
I did.
Okay.
On post-traumatic stress.
Got it. Okay. Oh, great transitions. Okay, let's see. And go. Can everyone see that? Beautiful slide.
It is beautiful.
All righty. I did my project on PTSD. You can go to the next slide. Okay, you can go to the next one. Post-traumatic stress disorder affects 8 million people in the United States. The causes are a stressful experience, trauma, mental illness, and predisposition to mental illness. You can go to the next one. What is PTSD? Post-traumatic stress disorder is caused by exposure to an extremely stressful or traumatic event that is dangerous and life-threatening to you or somebody you care about, which you witnessed or lived through. You can go to the next one. Four types of PTSD symptoms are re-experiencing the symptoms, which are nightmares, flashbacks, triggers such as something you see, hear, or smell. And then you have avoiding the situation. And then negative changes in beliefs and feelings, and difficulty sleeping, concentrating, or exaggerated startle response. And how does it affect the body? PTSD is a mental health condition that is gradually affects the body. It can change how a person thinks, feels, and behaves, and causes considerable distress. If you have PTSD, you're at higher risk for depression, alcohol, drugs, and eating disorder, which can lead to development of certain medical illness. You can go to the next slide. And this is just a slide of showing you the difference between the two. You can go to the next one. How is it treated? It is treated in 3 different ways. It is cognitive behavior therapy, which focuses on changing the trauma-related thoughts, emotions, beliefs, and behavior. And then the next one is psychological treatments, include hypnosis and exposure therapy to safe re-experience and process trauma. And then they also do group and family therapy. And then the last one is medicine. They give you medicine to treat it. You can go to the next one. And this is just showing you what People who have experienced trauma are 4 times likely to become an alcoholic, to develop a sexual transmitted disease, 4 times more likely to inject drugs, 3 times more likely to use antidepressant medications, and 3 times more likely to be absent from work and to experience depression and have serious job problems, and 2.5 more times to smoke, and 15 more times to likely to commit suicide. And what should you report when treating somebody with PTSD? Is intrusive memories, avoidance, flashbacks, reoccurring nightmares, emotional numbness, insomnia, difficulty staying asleep, sense of being on alert or on guard, experience hopelessness about the future, and suicidal thoughts. You can go to the next one. This is just a picture of showing the impacts of trauma. Reenactment, loss of self-worth, loss of sense of self, loss of physical connection to the body, dissociation, loss of intimacy, shame, loss of trust, loss of danger cues, and loss of safety. You can go to the next one. And the best way to cope with PTSD is spending more time with people, mindfulness, exercise, journaling, counseling, and changing lifestyles. You can go to the next one.
Awesome.
Elizabeth, that was great. Your PowerPoint abilities are on point.
I got to tell you, Mrs. Weeks, all of these PowerPoints that we've seen are just first rate. I'm very impressed. Very, not just with the subject knowledge, but also with how much work they put into this. So,
yes,
wow.
Absolutely. And I loved the first slide that said we can avoid PTSD by not making you do this project.
Yes.
I know. I just want to, and I don't think that Elizabeth would mind me sharing this. I know Elizabeth was very, very nervous today. She has a fear of speaking in public.
She did good.
Yeah, she nailed it.
She did good.
Yeah, you nailed it, sister.
Yeah, I know this has been something that has been weighing on her very heavily since I introduced this project probably 8 weeks ago. I mean, when I introduced this project, her face just went. And since then, she's been worried about this project and speaking publicly. And I just want to commend you, Elizabeth. It was informative. It was knowledgeable. It had great graphics to it. I love the picture you put on there of the normal brain and the PTSD brain, because that does give us a visual aid to see, even though we cannot see mental illness, like I said, there is a change in the brain activity. So excellent job, Elizabeth. Excellent, excellent. I'm so proud of you.
Yeah,
I agree. Great job.
Yeah, your folks are killing it. It's I'm very impressed with every one of them.
Group of students, don't I?
Yeah. To be able to do this in front of us's and the technology, and to work through your phone freezing up on you, it's just, I'm very impressed.
Yes, very, very good.
I didn't mean to talk over you, Dr. Mullins.
You're great. No, I just wanted to say great job. Very good.
Okay, so next, excuse me, I'm so sorry. Does anybody have any questions for Elizabeth and PTSD? We hear about PTSD a lot now in the news, in the mainstream, because of soldiers coming back from war. So do you have any questions about PTSD at all?
I don't think it's really a question, but my former principal at my private school that I went to was a retired Green Beret, and he had been paralyzed after a parachute jump. But he couldn't, like, when people would do fireworks, he would start to have flashbacks, and it's a very real thing. And I don't think a lot of people realize how real it is.
Absolutely. And yes, Madeline, you're right. Like I said, we do see it now in the mainstream media a lot, but I don't want you to forget that PTSD can occur from childhood trauma, whether it be rape, abuse. It can also occur from marriages, previous marriages, in abusive relationship with husbands and things like that. So PTSD is very real. And like Elizabeth said, there's so many things that go along with the PTSD diagnosis. And I just want to say, Elizabeth, you did a great job. Very informative. Very good. Anything else anybody want to add? Okay. If not, we will go on. Miss Madeline? Madeline, you're on mute.
And I'm trying to unmute her myself. It's not letting me.
All right.
There we go.
Sorry, I'm in my house in Cleveland, and there's not a whole lot of places to put things. Can you see my poster? No.
Yes. Perfect.
Is that better?
Huh?
All right. I'm Madeline Tink, and I will be doing my project on polycystic ovarian syndrome. Polycystic ovarian syndrome is a common hormonal disorder that affects ovaries in women during childbearing years. It's very common. More than 3 million cases in the U.S. are diagnosed every year. Treatments can help manage the condition, but there's no known cure. It often requires lab tests or imaging to determine that that is exactly what it is. It can last several years or it can be lifelong. The common ages for the diagnosis to be made is 18 to 35, and family history can increase likelihood. Both of my older sisters have PCOS, and so there's a higher chance that me and my little sister will also get it. But women with PCOS may have infrequent or prolonged menstrual periods, or an excess male hormone, which are the androgen levels. The ovaries may develop numerous small collections of fluid follicles and fail to regularly release eggs. I don't know how well you can see it, but this is a picture of, this is a normal ovary, a healthy ovary, and this is a polycystic ovary. And the exact cause of PCOS is unknown. An early diagnosis as well as weight loss may reduce the risk of long-term complications such as type 2 diabetes and heart disease. The symptoms are irregular periods. Infrequent, irregular, or prolonged menstrual cycles are the most common sign of PCOS. For example, you might have fewer than 9 periods a year, or more than 35 days between periods, and abnormally heavy periods. Excess androgen. Elevated levels of male hormones may result in physical signs such as excess facial hair and body hair, and occasionally severe acne and male pattern baldness. Like pictured here, it'll go bald at the top. PCOS signs and symptoms are typically more severe if you are obese. You need to see a doctor if you have concerns about your menstrual period, if you are experiencing infertility, or if you have signs of excess androgen such as worsening hirsutism, acne, and male pattern baldness. Long-term monitoring of PCOS. Because of the many long-term health risks associated with PCOS, it is important to establish a good relationship with your healthcare provider and maintain appropriate counseling in order to reduce the risk as much as possible. Among the possible health concerns associated with PCOS, women with PCOS, in particular those that are overweight or obese, have a greater chance of developing high blood pressure, high cholesterol, type 2 diabetes, heart disease, endometrial hyperplasia, I think that's how you say it, I'm sorry, and endometrial cancer. However, there are a number of things you can do to reduce your risk. The first being weight loss. Losing weight for those who are overweight or obese and maintaining a healthy weight is the single biggest thing women with PCOS can do to stay healthy. In addition to easing your PCOS symptoms, following a nutritious diet and exercising regularly will help you. It'll lower your chances of developing heart disease, decrease cholesterol, triglyceride, I believe that's how you say it, and blood pressure levels. It'll improve your ovulation and menstrual patterns, reduce your insulin sensitivity, and lessen your chances of developing type 2 diabetes. You can also do hormone replacement. Due to the lack of periods often experienced by women with PCOS, the risk for endometrial hyperplasia and endometrial cancer is noticeably higher. PCOS sufferers that experience absent or irregular periods can lower the risk by having at least 6 periods a year. So, in women under the age of 35, it is common to prescribe the birth control pill. This contributes to regulating hormones and inducing a regular period. Use of the contraceptive pill is not recommended for people over 35, particularly those that smoke. Therefore, progesterone or progestins may be prescribed. Women with PCOS that are hoping to conceive will likely not want to go on birth control and will be prescribed fertility drugs such as Clomid instead. These medications can also offer protection against endometrial cancer. So those are just some ways to treat PCOS and get it under control. And that's the end.
Awesome job, Madeline. I feel like PCOS is another one of those diseases in women that you can't necessarily see, and that's why I get so aggravated when people ask, do you ever plan on having any babies?
Yeah, my sister, Mary, is infertile, and that's all she heard since she got married was, are you not going to have babies? Are you not going to have babies? And
yes,
you know, it hurts her. It really does.
It's very hurtful. Absolutely it is. And especially, you know, here in the South, our grandmothers, you go to church and you're of childbearing age, and that's the first thing they say. Or, you know, your mama, when are you going to have me a grandbaby? You know, I need a grandbaby, blah, blah, blah. And it's one of those things that is hidden by the body. And so people are not aware of it. So the more that we talk about these types of things, the more we make awareness of it. And I appreciate you doing that, Madeline. Thank you.
Good job.
Also, as far as PCOS concerns, as the new research is out there about checking insulin resistance, and they're finding that patients that have increased insulin resistance, if that is corrected early on, can then reverse some of the PCOS symptoms. The classic is you'll see one of the main things they're watching for now are telltale signs of PCOS patients is those that have that insulin resistance look, which they say is a little overweight, coarse hair on the forearms, some facial hair, as well as possibly some chest hair, and that all has to do with the release of the hormones. But if they can correct that insulin resistance, which is basically a pre-diabetic stage, they often will give those patients metformin, which is a diabetic medication. And then you'll find as soon as they're put on metformin, they get pregnant. So it's all about keeping that insulin resistance down. So just FYI.
And Dr. Mullins, it's funny that you say that, because I've personally, and I've had some friends that have dealt with some infertility issues, and I've heard, not me, I was never prescribed it, but I've heard that they prescribe metformin for fertility. Is that correct?
Yeah, that's right. And it's only used in this case when you have someone that has some insulin resistance, and typically PCOS, insulin resistance, and infertility go hand in hand a lot of times. So if you correct the insulin resistance with metformin, that then decreases the infertility ratio.
Interesting. Very interesting. Madeline, I appreciate that. And like I said, it is the big thing here in the South too. I really urge everybody, please don't ask people when, if they're going to have any babies, or are you going to have any more, or my husband and I were married 9 years before we had Swayze, and I had multiple people. I mean, when we would go to church, sometimes, little old ladies, they lose their filter. And I had one woman ask me one time if there was something wrong with me. So I encourage you not to do that, and understand that some women do have problems with infertility. So thank you, Madeline. I appreciate that. Anybody have any questions? Okay. Mercedes.
Can you hear me?
Mm-hmm.
Okay. So, can you see my poster good? Yeah. Okay, I'm Mercedes, and my poster is on COPD. I don't know if you can see. I can't put me in there because it's gonna that's as far as I can get. Okay, COPD stands for chronic obstructive pulmonary disease, which is a group of lung diseases such as bronchitis, which is increased mucus and inflammation, and emphysema, which is destruction and enlargement of the air spaces. These two types of diseases make up COPD and block the airflow and make it very difficult to breathe. COPD is not actually a specific disease itself, but instead it's a broad term to refer to lung diseases that make it difficult to breathe, like bronchitis, chronic bronchitis, and emphysema. The body systems that COPD affects various structural and functional domains in the lungs. It also has extrapulmonary effects as well, such as weight loss, nutritional abnormalities, and skeletal muscle dysfunction. These are recognized as systemic effects of COPD. When monitoring COPD patients, they should be evaluated on a regular basis, depending on the severity of the disease. Mild cases may be followed up to 6-month intervals, while others with more severe cases need to be followed up to 2 weeks to 1 month intervals. We as CNAs, like we've been told before, we're with the patients more than others. So for us to monitor, we need to be sure that we can help them increase exercise tolerance, and help prevent infections, like making sure everything stays clean and stuff like that. With exercise tolerance, it's good to have exercise when you have problems with your lungs, because the research that I read, the more you exercise your lungs, the better that they'll kind of work. And so with COPD, it's good to have a little bit of exercise. And if you notice that they aren't getting enough, it's good to try to encourage them to do so. Let's see. Also, COPD symptoms could be hard to recognize as COPD, because most people may mistake the symptoms as getting older or being obese or anything like that. They might just think that it's just
That, okay. When reporting COPD, you need to be sure you watch the symptoms, which include increased shortness of breath, wheezing, or a chronic cough. Coughing can be dry or with phlegm. You should also report chest pain, inability to exercise, fatigue, confusion, and blue pigmentation of the skin. When the skin pigmentation becomes blue, you need to report it immediately because that indicates that the body is not getting enough oxygen. The first thing that you could notice that turns blue is the fingertips and the lips. If any of these things occur, you need to report it to the nurse or head of charge as soon as possible. Treatments of COPD include medications, which is a bronchodilator or a steroid, supportive care, which is oxygen therapy, and self-care, which is like physical exercise and quitting smoking. And also diaphragmatic breathing, that's a hard word to say, which is breathing that is done by contracting the diaphragm, a muscle located horizontally between the thyroid cavity and the abdominal cavity. Therapies, rescue inhalers, and inhaled or oral steroids can help control the symptoms and minimize further damage. I also have some little FYIs. I didn't put all of them on the board because I ran out of space. But COPD is a common disease. More than 11 million Americans have COPD, and that number is continuing every day. COPD has no cure. It's a progressive disease. Patients eventually die of respiratory failure, or they'll die with the disease, like if there's no cure. Damage to the lungs from COPD can be reversed, but we can minimize the symptoms. And also, strong smells, like us with healthy lungs, I don't know if you've ever like smelled something real strong and it kind of take your breath away for a second. So if you can imagine that you have a lung deficiency and you smell something strong, it's just even worse for that patient. COPD flare-ups is an actual thing. It's when your usual COPD symptoms become much worse for several days or even weeks. Cases as such require a higher level of care. Each flare-up a person experiences furthers lung damage. COPD is not contagious. The most common cause of COPD is smoking. So if any of you smoke, I encourage you to quit. It's also the fourth leading cause of death in 2016, and I'm sure that number has went up. And I did some research too of like who has a higher chance of getting it, and it said that women have higher rates of COPD than men throughout most of their lifespan. We are, as women, are more likely to get COPD. I'm not sure why that is, but that's what it said. There is no single test for COPD diagnosis. It's based on symptoms or physical exams and diagnostic test results. During a physical exam, the doctor will do a non-invasive test to assess lung function. During this test, you'll take a deep breath and then blow into a tube connected to the spirometer that is called spirometry. And the pictures that I have, I guess I can like come a little closer. But with a healthy lung, as you can see, the air sacs are kind of normal. I don't know, can you see that? And then with you having COPD, the air sacs in your lungs are inflamed, as you can tell in this one as well. It's kind of like healthy, and this one's more inflamed and opened. Put you back on there. And
very
that
good,
my project.
Very good, Mercedes. You know, when you guys go work, a lot of you will go work in the long-term care setting, and you will see a lot of this diagnosis there, especially in more personally, not the research that Taylor did. We see it's, I've seen it more in men, because think about it, back 60, 70 years ago, we didn't know the damaging effects of smoking. And so the elderly population now, a lot of them have been diagnosed with COPD. So you will see this a lot. A lot of people don't realize that COPD is a combination of two illnesses that make up COPD. So that was very informative. Thank you, Taylor. Does anyone have any questions?
That was Mercedes.
I mean, Mercedes, I'm sorry.
That's okay.
No? Okay. Taylor?
Yeah.
Hey, I'm Taylor White, and I'm just gonna I did my project on colon cancer.
Excellent.
Colon cancer is also known as colorectal cancer. A cancer of the colon or rectum located at the digestive tract's lower end that is also dangerous and life-threatening. The colon is about 4 feet long. Together, the colon and rectum make up the large intestine. The colon starts in the rectum. Both of the organs are in the lower portion of your digestive system. The colon is also known as the large intestine. The rectum is at the end of the colon. The way doctors report colon cancer is by recommending certain screening tests for healthy people. Doctors generally recommend that people with an average risk of colon cancer begin screening around age 50, but people with an increased risk, such as those with a family history of colon cancer, should be considered screening sooner. Surgery is the treatment for colon cancer. Other treatments include chemotherapy, radiation therapy, targeted therapy, immunotherapy. What you monitor for is colonoscopy, biopsy, chest x-ray, CT scan, molecular testing in the tumor, blood tests, and MRIs. Also, the symptoms are diarrhea, constipation, unexplained weight loss, blood in the stool, abdomen pain, and bloating. They also use a scope to examine the inside of your body. The colon helps digest food and remove nutrients and water before sending the waste to the rectum. If you do tobacco, heavy alcohol use, it can be a risk for colon cancer. The survival rate on colon cancer is relatively high. It can take 10 to 15 years for abnormal cells to develop into the colon. A growing number of people with stage 4 colon cancer live longer than 2 years. People with a parent, sibling, or offspring with colon cancer have 2 or 3 times the risk of developing colon cancer compared with those with no family history of the disease. Colon cancer is also the second leading cause of cancer death among men and women combined in the United States. This disease is most common in people over 50, but younger people also can get it too. Although the death rate from colon cancer has been drooping for the past 30 years, it is still the second leading cause of cancer death in the U.S. The overall lifetime risk of developing colon cancer is 1 in 21 in men and 1 in 23 for women. There are currently more than 1 million colon cancer survivors in the U.S. And I have a few pictures up here. And that is my project.
Very good, Taylor. Very, very good. She did a great job of explaining to us what exactly the colon does and how it works, and then how the cancer invades the colon. So does anybody have any questions about colon cancer?
What would be the first symptoms that you would have if it was at the beginning stage of colon cancer before you knew you had it? What would we watch for? And you might have covered that.
abdominal pain.
Okay. And what kind of doctor?
Good.
Okay, okay.
Anybody else? Okay.
I like
Let's-
the fact that she had a camera person working her camera.
I know, I like that too.
Yeah, so let's improvise, adapt, and overcome. That's wonderful.
Right.
That's grade A work.
Teamwork makes the dream work, right?
That's right.
So we only have two more, Miss Eden and Shamara. Miss Eden, it's your turn.
And Miss Eden, did you send a PowerPoint or anything that I need to pull up? Okay, I've unmuted you, Miss Eden. Did you send a PowerPoint or anything that I need to pull up?
Sorry, I don't have a PowerPoint. I have like this, but I have inside the house. But
Right.
I am in outside. I don't know if you can see, but I have handle also in mine. Hope you understand my English.
Yes. Very good.
I'm 18. My first project is arthritis. Arthritis is a great general term that refers to inflammation of swelling of joint. It causes stiffness, pain, and decreased mobility. Arthritis may be the result of aging, injury, or an autoimmune illness. Autoimmune illness causes the body immune system to attack normal tissue in body. Two common types of arthritis are osteoarthritis and rheumatoid arthritis. This is my picture. I have in poster point that it's hard. My picture in rheumatoid arthritis, osteoarthritis, also called degenerative arthritis or degenerative joint disease, is common type of arthritis that affects elderly. What body system does affect? It occurs with itching or as the result of joint injury. Hips and knees, which are weight-bearing joint, are usually affected. Joint and fingers, thumbs, and spine can also be affected. Pain and stiffness seem to increase in cold, damp weather. Rheumatoid arthritis can affect people of age. Joints become red, swollen, and very painful. Deformities result may be severe, disabled movement, and eventual restricted. I have a picture of this like a rheumatoid with the fingers, the curve. Body system does affect rheumatoid arthritis, usually affect the smaller joint first, then process to the larger one. Other parts of body that may be affected: heart, lungs, eyes, kidney, and skin. Symptoms: fever, fatigue, and weight loss. What is the treatment? Arthritis is generally treated with the following: anti-inflammatory medications such as aspirin or ibuprofen, as well as other medication. Local application of heat reduce swelling and pain. Some people use simple hot and cold treatment. Some people use acupuncture and Chinese medical treatment, range of motion exercise, regular exercise, or activity routine, diet to reduce and weight or maintain strength. What can we monitor? We monitor joint pain, redness, numbness, and pain, and tenderness or swelling in the calf of affected limb. Joint pain, any managed in joint from disease or injury can interfere with your movement and cause a lot of pain. Joint pains refer to discomfort, aches, and soreness in any of the body parts. Joint pain be discomfort, pain, or inflammation arising from any part of joint, including cartilage, bones, ligaments, tendons, or muscles. Most commonly, however, joint pain refers to another arthritis. Pain is also feature of joint inflammation. Arthritis such as rheumatoid arthritis and osteoarthritis and infection and extremely rarely can be cause of cancer and shoulder pain. Within the joint is a common cause of shoulder pain, ankle pain, and knee pain. What we report stomach and heartburn can cause by anti-inflammatory medication. Some residents cannot take this medication. Report signs of stomach irritation and heartburn immediately. Any problem with appetite and increased pain, abnormal pain, vital signs, especially a change of temperature. And that's all.
Very good, Miss Eden. Very informative about rheumatoid arthritis. My grandmother and my mother-in-law both suffer from RA. So I understand how debilitating this disease can be. Does anybody have any questions?
Miss Eden, I'm going to mute you for a second and see if I can cause your video to work, just so you could hold up one of your visual aids just to see if this works. I know you have very poor internet connection out there. So I'm going to mute you in 3, 2, 1 and see if your video comes up. Yes, your video came up. Let me pin your video. And it went back out when I tried. There we go. Hold up one of your video aids, Miss Eden. One of your pictures you tried to show us during your presentation. Excellent. Very good. Okay, I'm going to unmute you now. Thank you for that. You're helping educate me on how to do this Zoom thing as well. So
very good job, Miss Eden. Does anybody have any questions about RA? No? Okay, Shamara, she's our last one.
Hey everybody, my name is Shamara and I did my project on Down syndrome. And this is my poster.
Excellent.
The definition of Down syndrome is a condition which abnormal cell division resulting in an extra member of 21 chromosome, which you have 3 copies instead of 2. And what body system does it affect? It affects the heart, the guts, the ears, the eyes, the brain, the thyroid gland, and the nose. Where's my other card? And the hormone system and the skeletal system. And the lifespan you can have is from birth until 60 years at the max. But when the baby is first born, you can have heart disease from it. But when you're pregnant, they can do certain tests to figure out if you have Down syndrome, such as blood tests and the ultrasounds. And what can we do to monitor Down syndrome? You can have primary care physician to monitor growth and development, and you can have speech to be able to communicate. And you can have language therapy to try to, get their speech correct. And occupational therapy to assist to everyday tasks and to condition to match their needs and disabilities. And you can have occupational therapy to refine motor skills and daily tasks. And you can have physical therapy to exercise muscles and to help them with everyday tasks. And what should we report if you find out they have Down syndrome is to see if they have upward slant eyes, flat facial features, short neck, small ears, decreased muscle tones, and you can tell by their hands. And another therapy you can have is emotional and behavioral therapy to find useful responses to both desirable and undesirable needs. And I did Down syndrome because I always wanted to work with kids that have Down syndrome that need special needs when I get in the healthcare field. Yeah, I want to know, do anybody have questions about Down syndrome?
Very good, Shamira. So you said that you can notice or you can see things differently about their hands. What about their hands is different?
Like their hands are kind of short and kind of nubby.
So you probably you really enjoyed our tour at the Baddour Center then.
Yes, I always wanted to work with kids like that.
Yeah. The Baddour Center is an amazing facility that we did get to tour right before the world shut down, right before spring break. And I'm sure, Shamira, that you saw a lot of that there, and it even deepened your love for that population.
Yeah, and I have pictures on here of them.
Very good. Very, very good. Does anybody have any questions about Shamira's project on Down syndrome?
I just have a general question. Do those with Down syndrome, do they have a typical lifespan that's like the rest of the population? Is it about the same length? Is it longer? Is it shorter? Is there anything that we know about that?
It's actually shorter. The max is 60 years that I had searched up, from birth to 60 years at the most.
Wow. Thank you.
I know that and I could be wrong on this, so if anybody wants to correct me, but I'm pretty positive that they have some heart issues that go along with Down syndrome.
Right.
Yes, they have it. They can have it at birth when they're first born.
And they also have a hard time maintaining their weight as well, which can cause problems, which we know that can cause diabetes, and then it can cause joint problems, hip problems, knee problems, all of those things. So you really want to encourage regular exercise for those patients. Very good, Shamira. Anybody else?
That's good.
No? Dr. Jones, Dr. Mullins, I really appreciate y'all coming and sitting in on the students' poster projects. I know they're very proud of themselves, and I couldn't be any more proud of them. They did wonderful, especially given the current situation that we are dealt with. But everybody researched exactly how I expected them to. They did great visual aids. The PowerPoints were excellent. The posters were excellent. And I didn't hear any of them fumbling over words or anything like that. Did y'all?
No, I didn't.
It was great. It was really good. And I'm so incredibly proud of y'all. I know you're glad to have this under your belt behind you. This is one of those things that I feel like keeps a lot of people up at night. Most people don't enjoy speaking in public. So I just want to commend y'all and again, tell you how proud I am of the research that you've done and how much you informed me on things that, I didn't know. So thank you. Thank you so much. And Dr. Jones and Dr. Mullins, thank y'all for sitting in and weighing in on the students and all of those things. Do y'all have anything to add?
I just want to say it's been a privilege and it's been an honor to listen to you all. I'm very, very impressed. And thank you, Ms. Weeks, for orchestrating this. I know, Ms. Kramer, you did as well, and at your campus. And I'm just, kudos to all of you.
Mrs. Weeks, Dr. Mullins, Mrs. Kramer, I'm impressed. I come from a liberal arts background. I've taught in doctoral programs. I taught in an MBA program where students were required to get up and give a business presentation very much like this every single course. So they did it every 4 to 6 weeks. They had to prepare something, get up and present it just like your folks did. And Mrs. Weeks, your guys knocked it out of the park.
They did, absolutely.
I am astounded at how well they did, whether it was with a poster, with the incredible PowerPoints, with all of it, and working through the technology when the phone freezes up on you, when the camera isn't working, when all of that, and just pushing through and doing it anyway. Gosh, I am spellbound. And just so you know, I was so impressed with it that while you guys were doing this, I set up a YouTube channel. And this is going to be published on that YouTube channel if you guys want to go back and take a look at yourselves. It's amazing. It really is. So great job. Thank you for letting me be a part of it.
Yeah.
Thank you so much. Dr. Jones and Dr. Mullins, I have a question. I asked the ones that did posters if they could bring them to the classroom when we go back. Is that okay?
Yes. I would love to display them. Yes.
Okay. Thank you.
Very good.
If nobody has any questions, we can end our meeting now, and I will talk to you tomorrow. We don't have a meeting or anything tomorrow, but I'll keep in touch tomorrow. Do y'all have any questions about anything? Good job.
Excellent job, everyone. Thank you so much.
Thank you so much. Thank you, Ms. Kramer, for attending too.
I enjoyed it so much. I'm so proud of your students. I mean, just like Dr. Jones said, I am very impressed.
Thank you.
That speaks to you as a teacher, Miss Weeks.
Yes, Miss Weeks.
Good job.
Hey, don't give her all the credit. She'll want me to pay her more.
Exactly.
As she should.
Dr. Jones, at this point, I just want to come back to work.
That's right. Yeah, we saw the dog climbing in your lap. So I will send Mrs. Weeks the link to the YouTube video as soon as it gets uploaded. It's rather lengthy, so it's going to take a minute. But go back and take a look at yourselves. You did a great job. You really did. Thanks, everyone.
Thank you so much.
All right. Bye-bye.